Welcome to another episode of the Med Madness podcast. Today we're diving deep into a complex and critical condition known as Antiphospholipid-Antibody syndrome, or APS. This autoimmune disorder can have serious implications, particularly for pregnant women, and it's crucial for us to understand its diagnostic criteria, clinical presentation, pathophysiology, and treatment. First, let's discuss how to diagnose APS. To diagnose APS, we look for a combination of clinical and laboratory criteria. From a clinical perspective, APS can manifest in a couple of significant ways. The first is vascular thrombosis, which can occur in either arterial or venous systems, leading to events such as strokes or deep vein thrombosis. The second major clinical presentation is pregnancy morbidity. This includes having 3 or more consecutive unexplained fetal losses before the 10th week of gestation, at least one unexplained fetal loss after the 10th week, or one premature birth of a normal neonate before the 34th week due to conditions like preeclampsia, eclampsia, or placental insufficiency. On the laboratory side, the diagnosis of APS requires the presence of specific antibodies. These include lupus anticoagulant anticardiolipin antibody and anti-beta-2 glycoprotein 1 antibody. These antibodies are critical markers disrupting normal blood clotting processes and leading to the hypercoagulable state characteristic of APS. Patients with APS often present with a range of symptoms and complications. For example, they may have abnormal serologic test results such as a positive VDRL, which is a test commonly used to screen for syphilis, or a prolonged activated partial thromboplastin time, a test that measures blood clotting. These abnormalities are due to the antiphospholipid antibodies interfering with the tests, causing false positive results and artificially prolonged clotting times. Additionally, mild thrombocytopenia, which is a lower than normal number of platelets in the blood, is commonly seen due to immune-mediated destruction of platelets. Next, let's explore the pathophysiology of APS. The pathophysiology of APS is quite fascinating. The antiphospholipid antibodies disrupt the function of both platelets and vascular endothelial cells, creating a hypercoagulable state. This means the blood is more prone to clotting than it should be, which can lead to significant complications. In pregnancy, this hypercoagulability affects the uteroplacental arteries, which are critical for supplying blood to the placenta. Thrombosis in these arteries can cause a decrease in placental perfusion, leading to recurrent pregnancy losses, fetal growth restriction, and stillbirths. Given these serious complications, the treatment of APS involves anticoagulation therapy to reduce the risk of thrombosis. For non-pregnant patients, warfarin is commonly used. However, in pregnant patients, low molecular weight heparin is preferred because it is not associated with teratogenic effects and is safer for both the mother and the developing fetus. Additionally, low-dose aspirin may be used in combination with anticoagulants to further reduce the risk of thrombosis. To bring these concepts to life, let's consider a real-life case study. Imagine a young woman named Emily who has had 3 consecutive spontaneous abortions, each one devastating and unexplained. Additionally, Emily experienced a transient ischemic attack, a temporary period of symptoms similar to those of a stroke. Suspecting an underlying issue, her doctors conducted a series of tests and discovered that she had a positive VDRL test and a prolonged activated PTT. Further investigation revealed the presence of lupus anticoagulant and anticardiolipin antibodies, leading to a diagnosis of APS. Understanding the risks associated with APS, Emily's medical team initiated anticoagulation therapy with low molecular weight heparin. This treatment aimed to prevent further thrombosis and improve her chances of a successful pregnancy. With careful monitoring and management, Emily eventually carried a pregnancy to term, delivering a healthy baby. Her story underscores the importance of recognizing and appropriately managing APS to prevent its potentially devastating complications. In conclusion, APS is a prothrombotic autoimmune disorder that requires careful diagnostic and therapeutic approaches. Understanding its criteria, presentations, and treatments is vital for healthcare providers, particularly when managing patients with recurrent pregnancy losses or unexplained thrombosis. Thank you for joining us on this episode of the Med Madness podcast. Stay tuned for more insightful discussions on critical medical topics.